Let me ask you something. Have you ever answered an NCLEX question and felt like all the options looked correct? You understood the condition, you knew the content, but you still picked the wrong answer. And if you are an international nursing student, this can feel even more confusing because you are trying to adjust to a new exam system and different clinical priorities. So you start asking yourself, why do I keep getting priority questions wrong? How do I know what to do first? Here is the truth. The problem is not your knowledge, the problem is your planning, because this step decides your priorities. This is what most students do. They jump straight from assessment to action. They skip planning completely. So when they see options like give oxygen, reposition patient, call provider, or monitor vitals, everything feels correct. And now they are stuck overthinking, second-guessing, changing answers, and losing points. Let's fix this right now. Planning is not just writing goals. It is deciding what matters most and what must be done first. Planning is defined as developing measurable goals and selecting appropriate nursing interventions. That means you are setting a direction for care. You are asking, what do I want to achieve and what is my priority right now? Now let's talk about SMART goals. SMART stands for specific, measurable, achievable, relevant, and time-bound. Bad goal, patient will improve. Good goal, patient will maintain oxygen saturation greater than or equal to 95% within 24 hours. See the difference? Now, this is where everything changes. NCLEX uses three major frameworks: Maslow's hierarchy, ABCs, and safety. Maslow says basic needs come first, so always prioritize air, food, and safety before emotional needs. ABCs is your most important tool. Airway, breathing, and circulation. If the airway is blocked, nothing else matters. That is your priority. Safety means preventing harm, like fall risk, infection, or medication errors. NCLEX loves safety questions. Let's test your thinking. Which patient should you see first? A, patient with pain, 8 out of 10. B, patient with oxygen saturation, 88%. Correct answer is B, oxygen saturation, 88%. Why? Breathing problem. ABC's priority. Breathing comes first. Scenario 2. Which action should the nurse take first? Administer pain medication, reposition patient, apply oxygen, or call the provider? Correct answer is C, apply oxygen. Because again, breathing is priority. Always think ABCs. For my international students, this is where you must adjust. NCLEX is not asking what you would do. It's asking what is the priority action. That difference is everything. Use this rule every time. Airway before breathing, breathing before circulation, safety before comfort, actual problem before risk. Now be honest, do you struggle more with priority questions, especially on NCLEX style exams? Comment below. If you are an international student preparing for NCLEX, this series is for you. Pass your next exam using RN and LVN refresher online help from Gab-Nic Excelsior Nursing Tutoring Center. Go to my profile, tap the link in my bio, and choose your course. And don't forget to check my description on YouTube for full lessons.
Profile. Once you're in, select the RN Refresher course. You'll also find a weekly timetable to help you study consistently and stay on track. So you don't feel overwhelmed while studying, revisit important topics. It's not just about studying harder. So if you're ready to improve your understanding and stay consistent,